Okay, Dennis, let's talk about something absolutely fundamental to everything we do. Yet something I suspect many of us could be much more intentional about: our exams. Quick question for you, and be honest with yourself. Does your comprehensive exam look drastically different from your recall exam? How about compared to your limited or emergency exam? Or do they kind of blend together depending on how busy the schedule is? I see it all the time. Dentists who are fantastic clinicians, sharp minds, but their exam process, it's inconsistent. It's dictated by the clock, by the pressure of the next patient waiting, rather than a clear, intentional system designed for optimal diagnosis and patient communication. We might nail a comprehensive exam occasionally, maybe on that perfect new patient who booked plenty of time, but how often have you truly sat down and mapped out exactly what constitutes a thorough, comprehensive exam in your practice? A process you're proud of that utilizes all of your diagnostic tools available: x-rays, photos, scans, gum measurements, visual inspection, and results in a clear presentation that helps patients understand the situation and accept the treatment they need? Or is it more haphazard? A quick look around, check for obvious fires, and move on. And recall exams, oh boy. Those can be all over the map, can't they? If you're running behind trying to get back to that root canal, the recall check might be lightning fast. Maybe a quick glance at the x-rays, poke a few teeth, and you're out. Barely helpful. Other times, maybe if there's a cancellation, the recall exam suddenly balloons into a mini comprehensive, digging into things that weren't planned. And is there even a defined purpose for what you aim to achieve in that specific recall window? Limited exams are often the same story. First off, how many patients are getting limited exams when they actually have multiple issues and haven't been seen in years? They really need a comprehensive evaluation, but we slot them into a limited spot because it's easier or faster. That's a huge disservice. We need to actively work to minimize limited exams, especially for our new patients, and guide them toward the comprehensive evaluation they deserve. If you don't feel like you have a good pulse on things, it might be worth checking the last few months and saying how many of your new patients were actually brought in for a limited exam and not a comprehensive. So today, I really want us to get clear on the distinct purposes of these three exam types. I want to help you map out what a truly intentional, high-quality exam looks like, because getting this right impacts everything: your diagnostic accuracy, your case acceptance, your efficiency, your stress levels, and ultimately your ability to help patients achieve and maintain oral health while building a more profitable and fulfilling practice. So let's break it down. First, the comprehensive exam. The name says it all. This is the cornerstone, the foundation for every single one of your patients. Its core purpose is really about achieving two critical outcomes, viewed through a totally comprehensive lens of that individual patient and their unique situation. The first major objective is to establish precisely what treatment is needed to get that patient to ideal oral health. This means leaving no stone unturned. We need to meticulously diagnose every issue present: decay, wear, perio problems, bite discrepancies, soft tissue abnormalities, everything. This requires thorough diagnostic information and using all the necessary tools at our disposal. Things like meticulous charting, perio probing, the right x-rays, crystal clear photos, maybe even scans, whatever it takes to see the complete picture and define that treatment pathway clearly. The second equally vital objective is to establish the specific and personalized maintenance protocol required for that individual to maintain their oral health long term. Once we've guided them to stability, what exactly does it take to keep them there, considering their overall situation and the specific risk factors they have? What cleaning frequency is essential for them? What customized home care routines must they follow? What proactive measures or monitoring do their risk factors demand? This isn't a one-size-fits-all plan. It's a strategic, long-term blueprint built from that initial comprehensive understanding. We often don't think of it this way, but this is the comprehensive plan of oral health for this person, and there's lots of opportunities to add services to help this patient outside of just doing fillings and a crown. This comprehensive exam provides the roadmap. Ideally, every new patient receives this on their first visit. There are very, very few exceptions. There are also lots of existing patients who have had significant medical changes or who have fallen off the wagon for several years and return with multiple issues. They often need a new comprehensive exam too, because their situation has fundamentally changed. Trying to patch things up during a recall visit for these patients is inefficient and often leads to misdiagnoses. If circumstances have dramatically changed since their previous comprehensive exam, we need a new one. This exam takes time. It requires focus, proper documentation, and clear presentation to the patient using photos, visual aids, and anything else you've gathered. This is where you build trust and demonstrate value, setting the stage for case acceptance. It's not something to be rushed or squeezed between other procedures. Next up is the recall exam. What is the real purpose here? It's fundamentally different from the comprehensive exam. The recall exam is a monitoring visit. Its primary purpose is to check in on the plan established during the last comprehensive exam. You're asking things like, is there previously diagnosed treatment that still needs to be completed? Is the patient maintaining their oral health? Is the maintenance plan we recommended actually working? Are things stable? Are there minor new issues developing? A small cavity, early signs of gingivitis, wear and a restoration that needs addressing as part of that maintenance? During the recall exam, you're comparing the current state to the baseline established comprehensively. You're making sure they're completed any recommended treatment, and you're checking that their home care is being as effective. You're screening for changes. If everything looks stable, then great. You also address any minor wear and tear issues and reinforce the maintenance plan. But if something significant has changed, a major medical event impacting the oral health, suddenly getting rampant decay, severe periodontal breakdown, then the recall exam's purpose shifts. It becomes an identifier that the current maintenance plan isn't working or that underlying factors have changed. In these cases, the answer isn't just to keep patching things or recalls. The answer is likely that the patient needs a new comprehensive exam to reevaluate everything and figure out why these things are breaking down, and then establish a new roadmap and maintenance strategy. If a patient consistently presents with new problems at every recall, either they aren't following your recommendations or your initial recommendations weren't adequate for their risk level. That creates a comprehensive reassessment, not just another quick recall check. Recall exams are crucial for maintenance, but they are not mini comprehensive exams. They have a distinct, focused purpose, ensuring stability and catching minor issues early based on an existing comprehensive plan. Finally, the limited exam. This should be the rarest type of exam in your practice. Its purpose is highly specific, to diagnose and typically propose treatment for one specific acute problem for an existing patient of record. Think a broken tooth, localized swelling, sudden pain in a specific area. It's problem focused. You zero in on that single issue, you get the necessary diagnostic info, a PA, maybe a photo, and then determine the cause and address it. Where dentists get into trouble is using limited exams inappropriately. As I mentioned, new patients should almost never be scheduled for just a limited exam. Even if they call with a specific complaint, like pain, that initial visit is your opportunity to establish a relationship and understand their overall health. In most cases, you can still perform a comprehensive evaluation while also addressing their immediate concern. Maybe you triage the pain first, but the goal is the full assessment. Why? Because the limited problem might be a symptom of a larger underlying issue you'll miss otherwise. And similarly, an existing patient who hasn't been seen in 5 years and comes back saying, I have a few problems, doesn't need a limited exam or even just a recall exam squeezed into hygiene. They need a new comprehensive exam. Their situation has likely changed significantly. Trying to do a full workup in a limited or a recall slot is stressful, inefficient, and prone to all sorts of errors. The pattern I see, the laziness or lack of intentionality I mentioned earlier, is that these distinct exam types blur together. The limited exam creeps into trying to cover more ground. The comprehensive exam gets rushed and feels more like a slightly longer recall. And the recall exam becomes a chameleon, changing shape based entirely on the day's schedule and pressure. The result is misdiagnosis, incomplete treatment plans, lower case acceptance because patients don't fully understand their situation, and increased stress for you and your team trying to cram comprehensive work into recall slots. And ultimately, patients not receiving the optimal care they deserve. So here's the challenge. Here's the actionable steps. I want you to actually sit down, maybe part of it with your team, and map out your ideal process for each of these 3 exam types. Write down the specific purpose of each exam, the key components and steps involved in each, what data must be gathered, what diagnostics are standard, what does the patient communication part look like. Define the time needed for each type to be done properly without rushing. Then commit to sticking to that system. Train your team on the differences and the scheduling protocols. Protect the time needed for comprehensive exams. And ensure recall exams fulfill their specific purpose. Use limited exams only when truly appropriate. Being intentional about your exams is about elevating the quality of your care, improving your diagnostic capabilities, and building stronger patient relationships through clear communication. And it also creates a more predictable, less stressful workflow in your practice. It directly impacts your clinical outcomes and your bottom line. So, what do you think? Where do you see the biggest inconsistencies in your exam process right now? Is it time constraints, maybe lack of a clear system, team alignment? Let me know in the comments below. I'd love to hear what challenges you face with all the different exams in your practice. And if this resonated with you, and if you're ready to bring more intention to this critical part of your practice, hit the subscribe button. We're all finding ways to make dentistry more fun, effective, and rewarding. And yes, more fun. So take what you learned today about making your exams truly count, comprehensive, recall, and limited, and put it into action. Define your process, stick to it, and watch the difference that it makes. Let's keep working together to make dentistry fun, fulfilling, and rewarding. Subscribe so you don't miss more in the next strategy, and I'll see you soon.